So as patients express their difficulties, and as clinicians pay attention to these difficulties, there is an increasing awareness that science should focus on trying to address these needs. And NovaVision has one of the very few that have actually been appropriately developed for that purpose. And I think is by far the company with the greatest experience in that realm. One of the challenges in designing strategies for promoting recovery of visual problems is trying to understand what causes the visual problems and how to design an intervention that taps specifically in those mechanisms. The idea that has emanated from the understanding of brain plasticity is that when you have an injury to the visual system, ultimately the symptoms that the patient presents are not simply the manifestation of the damage, but are the manifestation of how that damage impacted on the brain, how the brain was not able to fully compensate for the damage. And so, to begin with, the difficulties after an injury to the visual system are manifestation of plasticity, are manifestation of these changes that take place. And so the notion behind NovaVision is that if we can understand better what these plastic changes are like, we might be able to guide them. We might be able to modify them at an individual basis, patient by patient, so that the ultimate outcome might be as good as possible for the individual. In order to do so, we can leverage different ways of modifying connections in the brain. Fundamentally, we want to instruct the brain to pay attention and to process in different ways the type of stimuli that sometimes are not appropriately being attended to. And one can do so by changing the connectivity between certain parts of the brain. So the predicament behind NovaVision is to establish a strategy that will reinforce certain connections, the result of which would be to reduce the area of blindness that the patient has, and therefore offer them more functional vision that might translate into an improvement in reading abilities or driving abilities and so forth in day-to-day life. There is a number of studies using the NovaVision technique that have used, for example, functional imaging studies to understand how the brain of somebody with a visual problem is processing vision and how that processing is changed after the NovaVision intervention, the VRT intervention. Such studies provide evidence that indeed after the VRT treatment there are plastic changes in the brain. There are recruitment of areas that previously were not processing information and that now kick in to help compensate, to help recover some of the previous visual loss. As we start to understand those mechanisms at work, one can start thinking of ways to modify the VRT treatment even to make it even more effective than it has been to date. So what the imaging studies show us is that areas of the brain that previously were silent when presenting certain visual stimuli, presumably silent as a manifestation of the, or correlated with the fact that the patient was not aware of the stimuli, now show activity in response to the stimuli after the VRT treatment, suggesting that the type of processing of the stimuli has been modified and that modification ultimately is causally related to their improvement in vision. What we've come to understand is that the brain is plastic, and what the plasticity means is that the brain is capable of finding pathways, finding ways that were there before. I think that's critical, but that were there before in a sort of rudimentary way. They were there already, but they were relatively underutilized. because you were particularly using other pathways. And now these smaller pathways can not only be used, but in fact, remarkably, can be expanded. So it is unlikely that the brain establishes brand new connections that never existed in order to overcome a deficit. We wish that were the case, but so far the evidence for that is very, very small. However, what we do know is that the brain has incredible number of connections, many of which are relatively underutilized. They're being used for certain things, but they can be deployed to be used for other more important things if the need arises. And if it does, then it is possible for the brain to actually modify the strength of those connections. So for example, recent work from Elabat Plo and Lotfi Merabet combining a technique called transcranial direct current stimulation, which is a way to change plasticity of the brain directly through brain stimulation without having to do surgery, just transcranially. If you couple this technique of transcranial direct current stimulation with VRT, what they found is that you can get a degree of response in patients that normally would take 6 or more months of VRT treatment, but achieve this in half the time.